Hello, my name is Ed and I'm going to be your nurse for today. Today I'm going to be showing you how to insert an indwelling catheter or a Foley insertion. Today I have a 50-year-old female patient who has cancer and she's been having a hard time urinating for the past couple of days, and hence the doctor ordered for a Foley insertion on her to relieve the pain that she's feeling, and to alleviate also the distension of her distended bladder. At this point in time, I'm just going to go ahead and see and check my patient in her room. And I'm going to go and explain to her that the doctor ordered the procedure. And at the same time, I'm going to go ahead and if I can do an assessment, skin assessment on her before we do the bladder insertion. If she has, especially in the perineal area, if there is any signs of redness, developing sore or any rashes that's forming in there. And also the patient also has the right to refuse. And at the same time, when I go to her room as well, of course I'm going to introduce myself, do some hand hygiene, and I want to make sure I check on the doctor's order, and also double check my patient and check check for at least two types of identification on my patient, checking her wristband, and making sure that everything is correct. I have the correct patient and the correct order, and at the same time, the order also has the type of Foley that we're going to be putting on her, and at the same time, the size of the Foley as well. Once I'm also going to be educating the patient as to how the Foley insertion is going to be done. And I'm gonna let her know that the insertion is not gonna take long, but she will feel a little pressure on it, and I'm gonna be inserting a balloon in it after we put it in. And of course, before we do the procedure, we're gonna be exposing some private areas of her. Once I did all of that, now I'm ready to go and gather all my supplies. I'm gonna go ahead and get my the Foley from the storage area, from the clean utility area. And then once I get the correct Foley, I want to make sure I have the correct size of Foley. I want to make sure the bag is not open or doesn't have any tears in it, especially that the Foley is a sterile kit, just to make sure if it has any expiration date, just to make sure that the kit is not expired at all. Once I have all the documents, all the equipment, I'm gonna go back to my patient's room. Hi, Mrs. Smith. How you feeling today? Okay, I'm back. So I'm gonna be doing the Foley insertion for you today. Okay, I'm just gonna put the Foley kit on the table beside her bed, close to Mrs. Smith's bed. Mrs. Smith, before we proceed, I just want to make sure to ask you if you have any allergies to latex. No. How about any just kind of allergies or environmental allergies that you have? No. You said you haven't had a Foley before, right? Okay. I want to make sure we'll make it as comfortable as we can. Okay. Okay, just want to make sure I have the correct patient again. Just want to make sure it's my correct patient. Can you give me your name and date of birth, please? Okay, thank you very much, Mrs. Smith. I'm gonna go ahead. I did my OA wipes by gathering all the supplies, checking the orders. Now I'm gonna wash my hands. I'm gonna provide privacy for my patient, close the curtain, especially that we will be inserting a Foley, and I'm showing and showing some private areas. And at the same time, I already educated my patient about it, so I guess we're ready to do the Foley insertion. Okay, Mrs. Smith, I just want to make sure that you're comfortable. I'm gonna bring your bed high, okay? So it's easier, comfortable working height for me as well. I want to make sure that the patient is in supine position. Can you flex your knees for me? All right, let me just cover you with a bath blanket. So when we take your bed sheet or your sheets, your covers, it doesn't show all of your body, okay? And take the covers out, And then I'm just gonna expose your perineal area, okay? If you can just open your legs for me, flex your knees and just put both of your feet on the side, and if you can just drop your knees so it makes it open. In that way, it is safer for us to put the Foley in there. At the same time, it's gonna be easier also to get in there. It won't take us a long time, okay? All right, thank you very much, Mrs. Smith. Now, at this point in time, I'm gonna go ahead and do hand hygiene one more time. And I think I'm ready to open the package. Now, I will open the Foley kit. All right. I want to make sure I carefully open the kit without touching anything inside because it's a sterile kit. Now I'm gonna grab the sterile drape and then carefully put it in the middle of my patient's legs. I'm so sorry I don't have enough space in my kitchen. Okay, and then once that's done, I'm gonna go ahead and put my gloves on, the sterile gloves on. With my non-dominant hand, I'm gonna go ahead and put on the first glove on my dominant hand by holding on to the inside of the gloves and put the gloves, my hand inside the gloves. And then I'm gonna go ahead and put the other glove in my non-dominant hand without touching the inside of the glove. I'm just gonna go ahead and slide it in my non-dominant hand. Okay, once I've all gloved, we're ready now to do the Foley insertion. I have here the betadine solution. It comes in swab sticks, so I'm just gonna open it, pretending I open it. It comes in sticks. This is what I'm gonna be using to clean the perineal area. And then I also have here the lubricating jelly. I'm gonna open it and put it in my canister in here, and we are gonna be using this one to lubricate the tip of the Foley so it's for easier insertion. Okay, pretending I opened it already. And I'm gonna bring also the Foley kit. And I have here the syringe with sterile water. We are going to be using this to inflate a balloon once we get the Foley inside. I'm just going to go ahead and insert it in the Foley catheter port. Okay, now that everything is ready, I'm going to ask my patient if she's okay, and we're ready to start the insertion. Okay, once we're ready, I'm gonna go ahead with my non-dominant hand, open the labia minora of my patient, exposing the meatus. I'm gonna go ahead and clean that area, starting on the labial folds first, from up going down to the anus. And the next one, with another swab stick, the betadine swab stick, I'm gonna go ahead and clean the center area from the clitoris down to the anus, downwards. Once that's all cleaned, I think I'm ready to insert the catheter. I'm gonna have the patient take a deep breath once we insert the catheter. All right, Mrs. Smith, I'm just gonna dip this in the lubricating jelly. All right, Mrs. Smith, we're ready to insert your Foley, okay? Okay, I want you to just bear down, just relax, and take a deep breath once we start, okay? Okay, 1, 2, 3. Once we start inserting the Foley, I'm just gonna go ahead and advance until I see urine coming out of the tube. Once I see urine coming out of the tube, I'm gonna go and advance 1 to 2 inches more just to make sure I can have an area where I can inflate my balloon. Once I'm done with that, I'm gonna go ahead and hold the Foley with my non-dominant hand and inflate my balloon slowly. All right, once that's done, I'm gonna go ahead and pull gently the Foley just to make sure that the balloon is in place. Once that's done, I'm gonna tell my patient to just, he can now relax. All right, Mrs. Smith, you can now relax. All right, I'm just gonna take the syringe out and I'm gonna take my sterile gloves out and do some hand hygiene. All right, I'm just gonna put on the regular gloves on. All right, I wanna make sure I secure the Foley on my patient's thigh, so in case she moves, it doesn't get dislodged. I'm gonna put the Foley bag below my patient's bladder on the side of the bed or on the railing of the bed. Then once I got that done, I'm now ready to gather all my supplies and dump them in the proper receptacle. Okay, now I'm gonna go ahead and just see and assess the area, the skin of the perineal area where we insert the Foley, just to make sure there's no any signs of skin breakdowns, there's no redness, and there's no signs of infections starting. Are you okay right now? Do you feel okay right now, Mrs. Smith? She is fine and everything looks fine. I'm gonna go ahead and cover my patient. I'll take the bath blanket, okay? I'll give you your regular blanket back on. Okay, I'm gonna go ahead and take my gloves and perform hand hygiene. At this point in time, I want to make sure that my patient is in comfortable position, the bed all the way low. She has the call button if she needs anything, any personal equipments, personal stuff that she wants by her. And if I have to bring the side rails up, but I'm gonna have to do it with as per facility policy and procedures. Do you need anything, Mrs. Smith, right now? Before I leave, I want to make sure I check on the urine that's coming out of the Foley, checking for quality and quantity. And then now I'm ready to document. I'm gonna go ahead and document everything that we did today and what I see on the quality and the quantity of the urine as well, and the teaching that I did, and I'm just gonna document everything what we did today. Alright, Mrs. Smith, did you need anything for right now? If there's none, I'm just gonna come back and assess you later on after an hour, okay? And let's evaluate how you're feeling, okay? And maybe we can take a peek and see if the skin is okay. Alright, if you need anything, just call me, okay? Thank you very much and have a good day.